For our presentation, we did preventing recurrent C. diff in hospitalized patients using fecal microbiota transplantation, FMT, as a secondary treatment method.
Okay, I'm Marygold. I'm Ivly.
I'm Daniel.
And I'm Johanna. Alright, so what is FMT? FMT is a treatment of stool transplantation where the stool is placed from a healthy donor into another patient's GI tract to directly change the recipient's gut microbiota or to normalize the composition. And this is often used in patients with an infection such as C. diff or IBD or other bowel diseases such as Crohn's. There are several routes for delivering donor feces, such as oral capsules, colonoscopy, nasoduodenal, or nasojejunal tube infusion.
So the old policy and new policy. This policy comes from Stanford University Hospital. This is on the FMT procedure and protocol. For the old policy, originally, what they currently do is with CDI infection, they will usually treat first with antibiotics. There's a set number of antibiotics, a set dosage, a set route, how many times you take it for how many days. After that, if there is a first recurrence, they're going to go back up to the top and they're going to go through the antibiotics again. If there's recurrences after the first, they have some other antibiotics. They can do kind of the same antibiotics that they did. They can switch it up. Various different strategies that they have. Lastly, there's also a fecal microbiota transplantation as well for the multiple recurrence. However, with the new policy, what we propose, as supported by research, is that with the first occurrence, we are going to go ahead and consider the FMT protocol just right off the bat at the first occurrence, just because the research has supported that with FMT, they have a high likelihood of being cured of the Clostridium difficile infection as compared with antibiotic usage.
In this study at Emory University, there were more than 125 FMT procedures performed, and with a greater than more than 90% success rate, and shown by cessation of diarrhea at 4 weeks after the final treatment. And this study also states that after the FMT, the patients may experience irregular bowel movement, but it resolves within a few weeks. Okay, in this study, we discovered that most individuals are cured of CDI after the first administrations of FMT treatment. Well, out of 180 patients, 147 of them were cured, which is 82%. This chart shows 82%. Some patients needed second or third dose, which increased their cure rate to 91 to 93%. So the lower recurrence rate of FMT makes it ideal for implementation as a secondary treatment for CDI.
In this research, it talks about the cure rates between FMT and antibiotic therapy. It states in the article that 90% of patients who had FMT as a treatment were cured of C. diff, while 20 to 30% of patients who had antibiotic therapy were cured. So that shows that there's a very high superiority rate of FMT curing a lot faster and a lot better than antibiotic therapy. So FMT is included in some standard guidelines, but it also is only used after treating recurrent refractory CDI, so 2 to 3 severe cases of CDI. So this article also supports that FMT should be implemented sooner as a treatment because of the high cure rate and also because it would significantly reduce recurrence rates. So in this study, it further supports that FMT restores patients' gut bacteria to resemble the bacteria of the healthy donor, and it also shows that there are no severe short-term adverse effects that were noted to be in correlation with FMT. Continuing to state how FMT has a high success rate, this article says that 92% were cured from C. diff through FMT. And also, along with being superior to antibiotics for curing C. diff, it also helps to cure C. diff in patients who do not respond to antibiotics. And also, if the treatment does not work the first time, with each correlating or continuing dose, the response rate increases.
This article looked at several observational studies and randomized clinical trials and concluded that resolution rates of 70 to 90% have consistently been reported for treatment with FMT. The article also states that FMT could be effective in complicated or severe C. diff infection. We also gathered from this article that patients who have one recurrence have a 45% risk of further recurrence, and patients with multiple recurrences, that risk goes up to 75%. So our current policy implements FMT treatment after multiple recurrences, but from the information that we gather here, we know that after the first occurrence, it's very likely that there will be more occurrences. So this supports the idea that we should implement FMT even sooner. This article further supports the idea that FMT has a greater success rate than treatment with antibiotics. And this particular quote, the success rate for FMT was 85% compared to a 30 to 80% success rate that is typically reported with vancomycin. The article also mentions the different routes that are available for delivering the donor feces. This includes oral capsules, colonoscopy, nasoduodenal or nasojejunal tube. The route will depend on individual patient cases. For instance, colonoscopy is typically done, but if the patient cannot tolerate that or has had previous difficulties with colonoscopy, then they may opt for an oral capsule. This allows for some accommodation for patients.
So there are some limitations with FMT, although current evidence deems that FMT does not have many short-term adverse effects. The long-term outcomes are not known yet. Also, several cases have reported that there might be some link between FMT and some conditions such as peripheral neuropathy, idiopathic thrombocytopenic purpura, Sjögren's syndrome, and rheumatoid arthritis. Also, some cases have shown, mostly the colonoscopy route, that there have been some bowel microproliferation, and some people have had worsening of their diarrhea, although usually only minor gastric complications occur. And then lastly, patients may need multiple treatments of FMT in order to be cured from C. diff, and it doesn't always happen or be cured the first time. Go.
So in conclusion, with fecal microbiota transplantation, utilizing it as a secondary treatment is more effective than using antibiotics and has a higher rate of curing the patient. FMT also has a high resolution rate and has been shown to be more effective than antibiotic therapy in curing patients with recurrent C. For next steps, first thing is going to be doing an exhaustive review of your hospital's protocol for FMT and what that entails. After you do an exhaustive review, you can talk with an authoritative figure in your life, such as a charge nurse or another nurse leader, about your ideas for changing the hospital protocol and how to go about that. After that, you can start developing your presentation for the hospital board, thinking about what you're going to do, how you're going to do it, etc. Once you get approval for doing the presentation to the hospital board, you are going to go ahead and give your presentation, give your presentation of your ideas and your research. And then after that, if it's approved, you're going to go ahead and implement it. After implementing it, you're going to evaluate it, think about maybe next steps or changes that need to be made.